and an audio file will be provided to the participants at the conclusion of the conference call. So I would like to begin today's call by allowing those here on the project staff to briefly introduce themselves.
Good morning. My name is Christine Stewart. I'm one of the program managers here on the ATC.
Good morning. My name is Stephen Perez. I'm one of the HIV clinical specialists here at the ATC.
And good morning, everyone. My name is Brad Ward. I'm one of the other program managers.
Great. Thank you very much. And I'd like to ask those of you on the call from the health centers to also introduce yourself by health center. I'll just read out the names of those health centers who have registered, and please just introduce yourself, the names of those who are on the call, the positions that you guys hold, and where you're based. And so now I have unmuted your lines, so could those of you from St. Thomas East End Medical Center please introduce yourself?
Yeah, Wilbur Smith, Executive Director.
Hi,
Great.
Dr. Barbara Douglas, clinician.
Dr. Deborah Wright Francis, OBGYN, Medical Director.
Great. Thank you very much.
You're welcome.
Could those from Betty Jean Kerr People's Health Center please introduce yourselves?
Good morning. This is Vicki Wade, Vice President of Clinical Services here at St. Louis. Mark Stanford will be joining us in about 5 minutes.
Okay.
Great. Thank you. And those of you from South Dakota Urban Indian Health Clinic, please introduce yourselves.
Tammy Hoagie, I'm a nurse practitioner and the lead on our HIV program, and Ellen Rogers is our fiscal manager. She's also on the call.
Mark Stanford, People's Health Centers here in St. Louis, Missouri.
Okay.
And I think we have one more health center. Would those of you from Adelante Healthcare please introduce yourselves?
This is Dr.
Aveen. Hi. We're not in the same place, but this is Aveen Tafoy. I'm the CEO of Adelante, and the rest of my team is back in Phoenix.
And that's Dr. Bob Elk, the CMO.
Kathy Schmitz, Director of Operations.
And Tiffany Dillard.
Great. Thank you. Thank you all for introducing yourselves. Am I missing any health centers?
Health Department, the homeless program, are in San Juan, Puerto Rico.
Thank you. And anyone else who hasn't introduced themselves?
Oh, do you hear us?
Sorry, say it again.
Hi, this is from the San Juan Health Department, our homeless program.
Yes.
Supposed to be on the meeting today.
Yes, thank you very much. And so now I'm going to just mute your phone lines. If you do have a question during the presentation, just you can write your question into the chat box in the browser, or you can raise your hand using the raise hand function, and we'll unmute your line, and you can ask your question before the group. So, and with that, I'd like to welcome our first presenter of the day, Christine Stewart.
Thank you, Jarrett. And good morning. Thank you for all joining us. And I'm just getting over a cold, so my voice isn't as strong as it could be. So if you have any problems hearing me, as Jarrett mentioned, write something in the chat, and I'll get closer to the phone or clear my throat. But again, I'm one of the program managers on the ATC, National Center for HIV Care in Minority Communities. I'd like to welcome and congratulate all of you for being selected to be part of this 2012 HIV and Primary Care Learning Community, which is a project of the ATC and the HCMC. And we know that we requested a lot of information in the application, but it did create a picture of your health center that helps us identify the organizations that will make up this year's cohort. Right now, you represent 7 states from across the United States, and as well as Puerto Rico and the United States Virgin Islands. And once we've confirmed everybody's participation, we'll share with you the organizations that make up this new community. And just to let you know, we have reopened the application period to accommodate additional organizations for the cohort, and we're trying to get more organizations in the southern states of the United States. We don't have too many right now, but those organizations will not be identified until early March. So kudos to you for applying early to get a jump on things. And so for today's agenda, we're going to do an overview of the project, the benefits and opportunities for participation, briefly discuss the project structure, discuss the project participation requirements and expectations, a timeline for the startup, and touch on the community meeting that we've been telling you that to expect to attend, and open it up for a question and answer. And does anybody have any questions before I get started? And I know you're all on mute. If you do have questions, definitely, again, send your questions to the chat function or raise your hand, and Jarrett will unmute your line. So this project is led by Health HIV in close collaboration with the Primary Care Development Corporation, and I know we'll be joined by a member of that organization later on the call. The ATC is funded through the Health Resources and Service Administration's HIV/AIDS Bureau, AIDS Education and Training Center program, and through the Department of Health and Human Services Secretary's Minority AIDS Initiative Fund. The purpose of this project is to develop, improve, and enhance the organizational capacity of non-Ryan White-funded CHCs like yourself to provide primary care services and treatment to racial and ethnic minorities living with or affected by HIV. And as we all know, community health centers provide quality primary care services for racial and ethnic minority clients. The comprehensive structure of community health centers can offer potential for accommodation of HIV primary care, and the anticipated impact of this expanding capacity includes integration of new providers into systems of HIV care and identification and delivery of best practices and clinical guidelines to providers that serve these communities. The project is really intended to enhance the capability without Ryan White direct funding of primary care providers and community health centers, so they can begin to increase capacity to provide culturally competent, compassionate, high-quality, and life-sustaining HIV care as part of your overall expansion. This new ATC supports the President's National HIV/AIDS Strategy in reducing HIV-related health disparities by expanding HIV care and treatment capacity at the community level and facilitating linkages. And we just briefly want to reiterate the project goal, which is to increase access to comprehensive, high-quality HIV primary care for racial and ethnic minority communities severely impacted by HIV. And we accomplish this by establishing the HIV and primary care learning community, and that's what you're here for today. And next, Brad will discuss the clinical stages that we've outlined for organizations.
Good morning, everyone. We're very happy to provide this information to you today to give you a little bit better picture of what's going on, how we're moving forward through the learning community. It appears that we've had some technical difficulty with the presentation. We apologize. We're trying to get reconnected really quickly. There we are. Okay, thank you. Good, Jarrett, thanks. So hopefully you can all see the slide set, the slide on the clinical stages of HIV care. Great. It looks like nobody was disconnected. Good. Sorry about that for those of you who experienced that glitch. We apologize. In the number of years that we've been working with health centers and other primary care providers, and through a search of literature, we have been able to craft what we're calling our clinical stages of HIV care, and there are 4 stages in our spectrum of care. The first is foundation, which assumes that your organization is providing HIV testing either routinely as a part of primary care or to targeted populations within your organization, but that you're not providing primary care by your staff. Perhaps you refer out for HIV care, or perhaps you have a contractor who is on site to provide primary care. But that's how we've determined the foundation stage. Moving through the spectrum, stage 1, we assume that your organization is providing care by staff, but that care is for patients who are either low acuity or whose disease progression has not been so far that they're a complicated patient. Moving through the stages, stage 2 and 3, you move up to more complicated patients with more complex comorbidities and more complex needs, and so that's how we're staging you as organizations. We'll be conducting assessments with each of you to figure out which stage you fall into and determine how best to move you through the project. Stefan and Mona, our 2 HIV clinical specialists, will work with your clinical team to determine where your health center falls and what the training needs of your providers are. We'll do a more in-depth discussion with each of you as we begin to do the assessments. Just a word about staging. It's based on the capacity of the providers who will be participating in the project, as well as the capacity of your organizational systems to support care. Moving on. So again, we're welcoming you to the HIV and primary care learning community. Many of you are probably familiar with the collaborative model or a learning community model, but just to give you a brief overview, it's a group of your peer health centers from across the country who are working to support the integration of HIV into your current clinical systems. We provide avenues to allow you to share your learning with fellow members and discuss ways to overcome common challenges. And to follow up on the slide that we just had, the goal for each of the health centers is to move you from one clinical stage to the next. Your work through the HIV and primary care learning community will focus on clinical training, complemented by performance improvement activities targeted to organizational systems that support the integration of HIV care and treatment into your existing primary care practices. So we've developed a comprehensive HIV training package that provides learning resources and proficiencies necessary for the provision of HIV care within each clinical stage. The package is flexible so that it can help you prioritize the areas where you need training the most and is tailored to all members on your care team. We have separate menus for the physicians, mid-levels, nurses, and LPNs and MAs. We expect that movement through the proficiencies is self-directed with the support and guidance of our staff and clinical mentors. And while we understand that each of you will have varying pressures vying for your attention, we also feel like this is a really important component of your training, and the training is paced so that it works with your availability. We will offer guidance to you and your health center as we are able to assess the needs of your clinic and each of the providers involved in training. We'll also conduct a brief assessment of your clinic's current capacity and training needs, and we'll assess the individual needs of providers as well so that we can help advise on their training. Much of the clinical curriculum utilizes our training package through self-directed learning, but we will also provide webinars addressing the proficiencies within the training package, and you'll have access to HIV experts for structured learning sessions and the opportunity for on-site technical assistance from either your local AIDS Education and Training Center or from one of our staff. We're here to help you along the way. I'd like to next hand it over to our partner organization on this project, Primary Care Development Corporation. And Mazdak, I don't believe you've had an opportunity to introduce yourself, so please take that opportunity now as well.
Sure. Hello, everybody. My name is Mazdak Mazari, and as Brad mentioned, I'm with the Primary Care Development Corporation. We have been providing performance improvement support to health centers for over a decade now, and we're based out of New York City. We're really excited to be working closely with the AETC NCHC-MC on this project for this year. And I'm going to talk to you a little bit about the performance improvement component of this project. So as all of you are well aware, service expansion and clinical training can't be successfully implemented without first or concurrently addressing the systems needed to support the addition of clinical services. So through this project, we're going to be providing and coaching to each health center in the following areas. Revenue maximization, and through revenue maximization, we're really going to be focusing on decreasing the amount of rejected health claims from the total health claims. And specifically, we're going to be doing a lot of these components thinking about HIV services in mind, as well as looking at increasing the relative value units for the procedures that you are providing. In addition, we're going to be working around strengthening quality improvement processes that you all already have in place. We're going to be working on access, and that's both appointment access, traditional appointment access, but also looking at making your health centers a place where folks who are HIV positive feel comfortable coming, and working on recruitment and retention for HIV positive populations, and finally, population management. So we're going to be conducting an assessment to understand your organization's current infrastructure and systems in place in order to appropriately support your improvement activities. And ATC, NCHC, MC staff, as well as us at PCDC, will be working with your health center to develop a tailored work plan, including performance improvement activities. Now I'm going to hand it back over to Christine.
Thank you, Mazdak.
You're welcome.
And so we just wanted to discuss briefly some of the benefits of participating in this project. You might have heard it before if you've participated on any of our pre-application calls. But, this program is designed not only around the President's National HIV/AIDS Strategy, but it also takes into account the current environments, the pressures, other strategic healthcare objectives that are facing your health center today. So we try to meet you where you are and facilitate where you're going. So we've aligned our curriculum to complement the work that you may be doing for other initiatives. This initiative is an opportunity to learn from your peer community health centers that are operating without dedicated funding for HIV services. And we know that it might be sometimes hard to find other organizations like yourself that are trying to do this type of expansion. You also get the chance to expand your capacity and truly be the medical home for your patients living with HIV by providing these needed services in a trusted environment. You'll provide access to expert faculty, coaches, mentors, and restricted access HIV clinical training package that Brad has mentioned earlier. So next, how are we going to work with you? We're going to begin with an assessment of both your clinical capacity as well as systems and organizational capacity, as Brad and Matt both mentioned. We will send each of you an assessment to review and complete prior to an assessment interview. Further instructions for the interview will be included with the assessment once you receive it. After completion of the assessment and assessment interview, we will work with you to develop a work plan that will guide your progress through the project. We will also work to develop individualized training plans for each provider so those participating in trainings will have to complete a self-assessment form. All of our resources and tools are housed on the project's restricted access web portal called the Virtual Learning Lab. The lab can also facilitate communication and shared learning between sites so you can learn from your peers. Once your change team has been identified, and we'll talk about that a little later, we would like to orient them to the resources and tools available on the Virtual Learning Lab and how to access them. There's an entire team behind this project here to support you, and so after the assessment, we'll begin to assign staff to each of your organizations so that you have consistent points of contact for various project needs. You'll each have a coordinator who will manage overall needs and is your day-to-day contact if you have questions about the project. You'll have a performance improvement coach who will work with you to support the improvement activities and will be in contact on a weekly basis. You'll have an HIV clinical specialist staff assigned to your organization and who will work with you to develop training plans and guide your providers' training needs. And if necessary, some of your organizations, if you're at the stage, will also receive clinical mentors who will work with our HIV clinical staff to implement the HIV training package, and they're also local experts. Oh, and one other thing I forgot to mention, but to streamline communication about major learning community activities, we'll have weekly announcements sent by email, and we'll ask that you identify the key people within your organization that should receive these types of communications. So in terms of participation requirements and expectations, many of the CEOs and executive directors are on this call. We want you to know that the first task is to identify your 2 project liaisons or learning leaders. At least one of the learning leaders should be a clinical representative and someone who will facilitate integration of HIV clinical elements into your practice. The other individual should be someone who can champion the operational and programmatic components of this project. Learning leaders must be in a leadership role within your organization in order to effectively make decisions and influence staff. And both candidates should be individuals that are well respected by their peers and be able to affect change within your organization. So you might be asking what are the appropriate staff members for these positions, and we think that the medical director, the chief operations officers, the directors of nursing might be appropriate staff to fill these roles. Of course, there are others within your health center that might be appropriate. And we're going to be firm with these criteria since we've had some challenges during the first year when we tried to accommodate health center wishes to have someone that was not in a leadership role. But we found it was really, really a challenge to get things moving. They weren't in a position of power or couldn't influence the work of other colleagues. So we had problems with people assigning medical assistants as a clinical learning leader, and they really can't guide the learning needs of physicians and nurse practitioners and other mid-levels at the health centers. Or alternatively, we also had challenges working with the program coordinator that's only specific to the HIV component. We want to make sure that while we want to be inclusive and have as many people involved in the project as possible within your health centers, we also want your health center to be able to be successful and want to have that person that's participating be able to contribute in a way that best suits their background.
Additionally, we feel like it's really important to emphasize that the changes and the improvements that we're working with you to enact in your health center are organization-wide and are not limited to one department. That's why the emphasis is on pulling it out of a single department and pulling it up to the organizational level to ensure that the change is pervasive throughout your organization's processes, structures, and staff.
All right, and as Brad mentioned, because it's organization-wide, we want all senior staff should probably be involved in various parts of this project at some point. So, for example, participation of the Chief Financial Officer would be integral during the maximizing revenue part of our curriculum. Just as another note, we do want both learning leaders and your executive director to attend the face-to-face session that will occur in April, and the date is the 19th and the 20th, and we'll discuss a little bit more about that later on in this presentation.
Great. Thanks, Christine. So just a little bit more about the participation requirements and expectations. One of the first things that we asked in your application that we've seen in your responses is your commitment to develop or expand HIV services over the next year. And we were very specific about that because we feel like it's important, again, as we mentioned, because it's an organizational program, we want to see how that's integrated into your overall operating plan. One of the other things is that we will communicate expectations with staff who are devoting time to this project. So we ask you to consider what upcoming projects and activities you're engaged in that might pull these staff away from the HIV and primary care learning community and communicate that with us so that we can accommodate and expect a reasonable amount of time that you can devote to this project. Your participation is supported by and involves the CEO, whose role is to remove barriers for implementation changes and allow time to access learning resources and lead the effort to restructure systems or processes within your organization. This change is supported, as we mentioned, organization-wide and not solely through one department or unit. Another expectation that we have is that you participate fully in the organizational assessment, which includes both systems and clinical practice, as well as individual assessments of the providers participating in the project. A couple of more things to highlight. Some of you may be selected to participate in a site visit where members of the learning community team are on site with your health center to meet with your learning leaders, the CEO, and other key staff. Some of these may be for the assessment, and some others may come during the project year, but just please be aware that we'll schedule around your schedule and try to meet your needs as much as possible in scheduling these potentially scheduling these site visits. Two other things I'd like to highlight is that we ask you to be in regular communication with AETC, NCHC, NC staff, as well as your performance improvement coaches. Again, we can help you as much as we can as long as we know what's going on within your health center. The last thing we ask of you is to please participate in our evaluation activities. We understand that a lot of people request information from you, and that increases every day that you operate. So we want to try to keep the reporting burden as low as possible for you. We will, however, ask you to measure your improvement in areas of performance improvement as well as HIV care and treatment, and report these improvements back to us for the overall project evaluation. The assessment will be the first request, so we'll be doing that in a few weeks. We'll also ask you to report at midpoint and then at the end of the project year. You may have noticed that you had to complete what's called a personal information form, participant information form at the beginning of this webinar. We wanted you to see what that is like because that's what we ask of all staff who participate in our trainings. That's just something that you only have to complete it one time. You were assigned a number when you completed the participant information form, so please hold on to that number so that you can use it throughout the project when you participate in training. Christine?
All right. Now, in terms of timeline, I just want to briefly share with you some of the key activities that you'll be engaging in the next few months leading up to the face-to-face meeting. First, we ask that you acknowledge your understanding of the opportunities as well as expectations of participation in this learning community by completing a letter of agreement. Tomorrow we'll forward this letter so that you can review it, share it with your staff, and if in agreement, sign and return by Friday, February 3rd. You'll be asked to identify your change team at this time, and we're also going to send you, along with that, a description of the learning leaders that we shared earlier in this presentation. The following week, we'll distribute the assessment forms for you to review, complete, and return to us. And as we begin receiving the completed assessment forms, we're going to begin scheduling assessment interviews with members of your staff to review the responses and validate them and ask any questions that can help us with your work plan development. Scheduling will begin the week of February 13th. Most assessment interviews will be completed using Skype or some other web technology. However, we may request an on-site interview. It's not a bad thing. It's just we just might find it's easier to get some information when you're face-to-face. And plus, we want to meet you anyway. We'll also be confirming your selection of learning leaders during this call to work with you to make sure that your selection is appropriate and will help your organization be successful in this project. And in the weeks following your assessment interviews, we'll be working with you to each of your health centers to develop work plans. And in this time, that's when we'll probably also have our staff assigned to you, so you can start getting you'll have consistent points of contact. And then finally, your true learning leaders will attend the April face-to-face meeting in Washington, D.C., along with the CEO. And so again.
Great, thanks, Christine. As we were mentioning, the community meeting, April 19th and 20th, is really our first opportunity to meet you all as a group. We're very excited about that. We love the face-to-face interaction that we get to have with you at that meeting. And in addition to getting to meet you and you getting to know us as project staff, we'll deliver some of the content that's based on the results from your assessment, which aligns with the objectives in your work plan and with the work plans of your peers. As we've discussed, the meeting is on April 19th and 20th in the Washington, D.C. area. Specifically, it's in Crystal City, Virginia, which is just minutes from the Washington National Airport. We will cover all of the costs related to travel, including airfare or train fare, lodging, ground transportation, and meals. Once we confirm the learning leaders after the assessment interviews, we'll send you information about how to make your travel arrangements and be in touch with you in doing so.
Great. Thank you very much, Christine and Brad. And before we get to questions, I did want to ask if anybody joined after we had gotten started. If you have, please just introduce yourself and the health center that you're with.
Hi, I don't know if you get our names from the beginning. This is, again, Gloria Amador from the San Juan Healthcare for the Homeless program.
Go ahead, Gloria.
We are here, Dr. Nelson Almodovar, who's our medical director, and the project director, who's Luz Minerva Montalvo. Dr. Sorrentini, who's the director from the San Juan Health Department, just leave because we have something happened a few minutes ago. But we have been hearing all the information, and we are very sad that we did not get the information to get to the web base. So we will try to get the information later with you, the presentation, because we didn't have the opportunity to see the presentation while you were talking.
Okay, absolutely. And we can send the slides to you. And there's also a recording of it, so you can go through everything with our voices as well.
Perfect.
Great.
Great.
So this is Donna Keeler, and I'm the Executive Director at South Dakota Urban Indian Health, and I joined a little late. I believe Tammy Hoagie's been on the line.
Right. So welcome. Thank you.
Hi, Donna.
Hi.
Great. Thank you very much. And another thing I would like to point out is that if anyone wants to download a copy of this presentation, they can do so by going to the file function on the toolbar at the top of their screen, and they can select the Save As function and then Document. And that's a way for you to download a copy of the slides for future reference. So at this point, your phone lines are unmuted. If you would like to ask a question, please raise your hand using the raise hand button, and we'll call on you and ask you to ask your question before the group. Alternatively, you can chat a question into the chat box, and I'll read it aloud so that everyone can hear it.
We have options for the shy and the bold both.
Or since you're all a community, we can say what your question is, and you don't have to raise your hand. I'm not hearing any questions, but there was one thing I do want to make. I don't think we covered during the presentation. A lot of the work that we'll do with you will be utilizing business technology. So we'll be doing webinars, having conference calls, but we will have some opportunity for some on-site technical assistance as well. Just to be completely clear, so you know to expect that. And there's no cost to participate. If we ever ask you to travel for a meeting, we'll cover the cost of the participation. So that includes your travel, registration, things of that nature. Oh, speaking of registration, there is one other thing in terms of along with the community meeting, Health HIV is actually having their second annual synchronicity meeting. It's actually happening starting on the afternoon of the 20th and the 21st of April in the same hotel, same location. If any of you are interested in attending, because you'll already be there, we'd be happy to pick up the rest of your lodging costs and pay for the rest of your travel from the meeting. We'll have the agenda finalized in the next few weeks, and we'll send it along with other materials, so you can make that determination.
Hi, this is Amador from San Juan again. Yes, I have a question. It is requested that our executive director to participate in the meeting, but the San Juan Health Department is a health system, and Dr. Sorrentini is the person who is in charge of signing our proposals. He does not work directly with our program itself. So I just would like to make sure if he still needs to participate in the event, or if we can select the project director, the medical director, and some of our clinical staff to participate instead of the person who just signed the proposal, but he's involved in about 50 more programs, so I don't think he have enough time, or it's gonna be it will benefit more if we can include a leader of our program instead of the whole system.
You know, we know that each organization has a little bit different structure and a little bit different staffing. So when we have, thank you for raising that question. We'll be happy to talk with you individually about, offering guidance about how to select the right person or the right people to attend the meeting. And the same goes for any of the other health centers that are out there with a similar question. Well, if you have questions about who you should send, please talk with us one-on-one, and Christine and I will be happy to talk with you about who may be the most appropriate person to send. And I believe our contact information is up on the screen there, so you can reach either of us by telephone or email if you have questions. And Ms. Amador, we'll send you the slide set as soon as the call is over so that you have our contact information as well.
Thank you.
Great. Thank you for your question, and Brad, thanks for your answer. Does anyone else have any other questions regarding the project or logistics or anything at all?
Yes, this is Wilbur Smith, St. Thomas East End Medical Center.
Go ahead.
Yeah. Quick question. We are not a Ryan White grantee. During the consultations, would there be some help with this, guiding us through that process? We were once a Ryan White.
It's not something that is specifically offered through this project. However, several of the staff here at Health HIV have experience working in the Ryan White system, and would be happy to talk with you about how we may be able to assist you.
Appreciate that.
Sure.
Hi, this is Gloria Amador again. I have another question.
Okay.
Our staff mainly speaks Spanish. Do you gonna have available consultants or the technical assistant professionals who are gonna be working with us who speak Spanish?
We do. We actually have folks located in Puerto Rico who will be there to help you.
Okay,
and we also
perfect.
we also have Spanish-speaking staff.
And we actually have 2 organizations in Puerto Rico right now.
Okay, perfect.
That's a great question. Thank you very much. And anyone else with any questions, please feel free to ask any question that's on your mind about the project. And not seeing any other questions, so I think we will end this webinar now, and we will send you a link to the recording so that you can have the presentation for future reference. So thank you once again for participating, and I hope you all have a great rest of the day.
Thank you.
Thank
you, everyone.
An email with the letter of agreement and the learning leader description, we promise.
Thank you all.
Welcome.
Thank you.